Okay, so what is this shift summary about? What are we trying to do in this shift summary? It should be a really brief statement. It should be about a paragraph long, and it should hit 4 major considerations. The first is to evaluate the effectiveness of the current plan of care. You take basically what your plan has been with that patient, and you really are evaluating whether it's effective. Is the patient progressing towards our goal? We need to make sure, number 2, that we are identifying specific barriers to us achieving that goal, and then modify our interventions accordingly within the body of the care plan. The third is that it should be used as an interdisciplinary care team communication enhancement. So we can be making sure that we're including considerations about the physical therapy care that's being received, or wound care ostomy consultations and nutrition consultations that have happened with this patient. The shift summary looks at the patient globally, and so we really want to make sure that we're including the other disciplines in our shift summary. And the last piece is to make sure that we understand the patient's response to our treatment. So both objectively, how are they progressing medically towards the goals, and also holistically, how are they responding, or what's the patient's perspective to the care plan, and making sure that we make modifications that are considerate of that. So in summary, it is a summary that takes the 12 hours of care you did, the interventions you provided, and compares it to the plan that was in place, and you need to then summarize how that all went. I tell people who are struggling with this, especially new nurses, I usually lay it out like this. If you ran into the physician in the hallway between patient rooms and they said, "How's Miss So-and-so doing in room 201?" what would you say? And just exactly what you would say to that physician probably makes an awesome shift summary note.